My last slides are about what after having a guideline. So having a good guideline, or appraising and checking with using the GRADE instrument or the AGREE instrument, and seeing that this is an excellent guideline. Is that enough? Oh, actually not. It's not just enough to have a good guideline. We need also to be sure, to make sure that they are implemented in practice. Are there structures, the necessary structures, evidence-based policies, procedures in place in your hospital, in your environment where you're working? Are there these policies or procedures based on selected guidelines? And do the clinicians have the tools provided to administer these guidelines? Are you allowed, or do we have the facility to check for blood glucose when you need it, or order an oral glucose tolerance test? Then the processes, to what extent are providers complying with these processes? Are the clinicians aware of the guidelines? How much are they know in different important guidelines? At least the guidelines for the common diseases like hypertension, asthma, COPD, diabetes. At least these three should be very well known by practicing GPs at least, or internists. Then, does the guideline really have some effect regarding outcomes? Is it safe to use that guideline? What about the cost or patient satisfaction? So if the guideline does not achieve, although it may be very scientifically developed, it may not achieve good outcomes. That must be checked as well. Okay. Another point to discuss is the legal implications of applying clinical practice guidelines, because the guidelines are usually seen as the standard of care. So if you are accused with a malpractice, the judicial system will usually look whether you applied a guideline, your practice according to the actual guidelines or not. Providing care based on critically evaluated, evidence-based guidelines promotes a new standard of practice versus this is how we do it and how we have always done it. So we should switch from that, what I have seen and what I have done all the time, to what should be done and what is the new evidence telling us to practice. And of course, to ensure compliance is very important. Another side of the coin is this guideline fitting to me or my patients? Because there is no size that fits everybody. So in your practice, you are responsible for yourself to ask and tell and give the answer whether a certain guideline is appropriate for you or not. For that purpose, of course, you may use the information given in this presentation regarding the GRADE or AGREE instrument and decide whether that fits to you or not.